My name is Jordan, and I'm going to be doing a Foley catheter insert. I'm going to introduce myself to the patient, and I'm going to ID the patient with two identifiers. I can identify with the wristband, and I can verbally ask the patient what their last name and their date of birth is. And then I'm going to proceed by asking the patient if they have any latex allergies or any allergies to iodine. And I'm going to explain the procedure that I'm going to be doing. I'm going to be inserting a Foley catheter. That's to excrete urine from the bladder. I'm going to provide privacy. Before I open up my package, I'm going to check if I have all of my supplies. So I have a Foley catheter. This one happens to be a 14 French. I have a Foley catheter, and I have everything that I need. I'm going to make sure that my station is in the proper place so that I don't reach over my sterile field. I'm going to proceed to take the package out and open away from myself first without touching the inside. And then I can adjust because I have my 1-inch border, and I can perform hand hygiene. I can use the sink or I can use the alcohol. Next, I'm going to put on my sterile gloves. First, I can position the patient and make sure that the bed is at a proper working height. That's good. And I can fix this. And I want to put them in the lithotomy position.
Now this hand is wet. It is no longer sterile. It is considered clean.
Make sure that I have a
Sure
good
that I do
access.
not onto my
And now I can proceed to put on my sterile gloves. And I just did hand hygiene again. It's dry before I put my gloves on. Okay. Now I'm going to put my sterile gloves on. And I'm going to don my non-dominant hand first because that's what works for me. Some people can don their dominant hand first,
with my sterile hand,
but this is what works for me.
sterile 4x4.
My hands are sticky.
Place them on top of it. And again with my sterile
Okay, I can readjust after. I'm going to go underneath the cuff.
balloon. Now that I'm all set with sterile procedure, I can remove my gloves
Make sure that sterile touches sterile.
and
Put my gloves on. And now I can adjust because I am all sterile.
around
Okay.
in a window from fashion.
Okay. And now I can touch everything that's on here because I'm sterile and this is sterile. So I'm going to work within my 1-inch border. And I'm going to remove the top. I'm going to start by covering my patient.
And now I'm going to label that
We have to stop.